a deduction, a abduction. And you can do it also with your wrist, right? This would be a abduction. Hey guys, welcome back to another video. My name is Dr. Gonzalez, and today in this video we are going to talk about the following topics. But before we get started, don't forget to subscribe, like, and share. All right, let's get started. So, what is a joint? A joint is essentially a point of contact between two or more bones, also cartilage or bone, or teeth and a bone. Also, joints can be classified structurally and functionally. When I say structurally, it's like you can ask yourself, is there a joint cavity, or what type of connective tissue is there over there? And in terms of functionality, you can ask yourself about the degree of movement permitted in this joint. So the joints throughout the body hold the skeleton together and support movement. These joints are categorized by the range of movement provided. For example, we have the thin arthrosis, which allow no movement. For example, we have the sutures in the skull and the gomphoses on our teeth. The second type of classification is the amphiarthrosis, and these are joints that allow little movement. For example, we have the pubic symphysis and the intervertebral discs. And the third type of joint is the diarthrosis, which are joints that allow full movement or are freely movable. For example, we have the hip, knee, shoulder, and the elbow. By the way, this is every single joint in my body when I have to go to the bathroom at 3 a.m. in the morning. In general, synovial joints have a synovial cavity, and articulating bones are covered with an articular cartilage held together by ligaments, like this one's shown over here. They contain a synovial fluid and have a nerve and blood supply, and are also surrounded by an articular capsule. And these synovial joints permit a large range of movement. So now I'm going to go ahead and display the types of movement at synovial joints. And if you're at home, you can practice them with me at the same time, because by practicing you will learn better. You ready? Let's get started. So the first type of movement we're going to do is flexion and extension. Some joints, like those in your neck, you can do flexion by taking a bow, and extension by just standing normally like this. You can also do hyperextension, and that is if you move your neck kind of like looking towards the ceiling, right? So that is hyperextension. You can also do extension and flexion with your hips, right? So kind of like taking a bow like this is flexion, and then standing normally is extension. And then again, if you try it and look towards the ceiling, oh, this is some really good stretching over here. This is hyperextension, right? We can also do flexion and extension with our shoulders. So flexion would be like this, and I'm going to stand to the side, right? This is flexion. This is extension, and this is hyperextension. In terms of flexion and extension in our elbow, right, that is very simple. This would be flexion, and this would be extension. Some people can do also hyperextension with our elbows, but I cannot do it, right? In terms of the wrist, this would be flexion, and this would be extension. And then with our wrist, we can also do hyperextension. You can also do flexion with your fingers, kind of like forming a fist, and then we can extend them again one more time. In some instances, like myself, I can hyperextend my phalanx over here on my thumb, right? And you can also do it with your fingers, right? A little bit of hyperextension over there. You can also do flexion and extension with your hip simply by moving it forward. That's gonna be flexion. Standing normally, that is extension. And then hyperextension, just pushing your thigh backwards. Flexion, extension. Another type of movement that you can do, it's called abduction and adduction. So for example, this would be adduction and this would be abduction. Adduction, abduction. Abduction and adduction. If you do it in a supine position, I can do it again. Adduction, abduction. This is adduction and this is abduction. And then of course with the hip, you can do a abduction and a deduction. And while I'm doing these movements, this is my body choosing which type of pain I will have today. Knee or back, knee or back. Another type of movement is called circumduction. So circumduction is this. And you can also do it with your hip joint, like this. It's kind of like forming circles. Another movement is rotation at the atlantoaxial joints, like this. Like when you're saying no. There is the type of movement of rotation called also lateral rotation at the shoulder joint, like this. And you can also do it with your hip, similar like in the shoulder. This would be plantar flexion. This would be dorsiflexion. Inversion, eversion. Supination, pronation. Supination, pronation. This is a position of the carpometacarpal joint. With the temporomandibular joints, you can do elevation and depression. Depression, kind of like when you're shocked. And this is elevation. Protraction, retraction. And if you need more information about the skeletal system, I have more videos about the axial skeleton, appendicular skeleton, and bone tissue, so go over there and check them out. So that's it for today. Don't forget to subscribe, like, and share. And if you have any suggestions or comments, you can leave them on the comment section below. Thank you for watching. Protraction. These joints are protraction. Oh my god. Have or allow no movement. Pero qué me pasa? And if you need and then of course it would. I forgot I am in my sleepers.